What does cat insurance cover for cats? Cat insurance typically provides coverage for a variety of veterinary expenses. The specific coverage can vary among different insurance providers and policies. But here are common components of cat insurance coverage. Accidents and injuries. Coverage for veterinary expenses related to accidents and injuries, such as fractures, lacerations, and other unexpected incidents. Illnesses. Medical expenses for the diagnosis and treatment of covered illnesses, which may include conditions like infections, digestive issues, respiratory problems, and more. Diagnostic tests. Reimbursement for diagnostic tests, including blood tests, X-rays, ultrasounds, and other procedures recommended by a veterinarian. Prescription medications. Coverage for prescription medications, prescribed by a veterinarian to treat covered conditions. Surgery. Reimbursement for surgical procedures, both routine and emergency surgeries, as recommended by a veterinarian. Chronic conditions. Some policies cover chronic conditions that require ongoing treatment, such as diabetes or kidney disease. Hereditary and congenital conditions. Coverage for veterinary care related to hereditary or congenital conditions, which are conditions that may be present at birth. Cancer treatment. Some policies cover the diagnosis and treatment of cancer in cats. Emergency care. Coverage for emergency veterinary care, including visits to an emergency clinic or after-hours care. Hospitalization. Reimbursement for the cost of hospitalization and overnight stays at the veterinary clinic. It's important to note that pre-existing conditions are typically not covered, and there may be waiting periods before certain coverage becomes effective. Additionally, preventive care, such as vaccinations and routine checkups, may not be included in basic insurance plans, but some providers offer optional wellness coverage. Before purchasing cat insurance, carefully review the policy terms, coverage limits, exclusions, and any additional options available. It's also advisable to ask the insurance provider about any waiting periods and how claims are processed.